All right, welcome back to the innovation stage. I hope you're having an awesome time so far. This segment is brought to you by M12. Our next speaker is Mainul Mondal. He is the founder and CEO of Ellipsis Health. Please join me in welcoming him to our virtual stage.
Thank you so much. Thanks for everyone for giving us this opportunity. Thanks to M12 and our friends at Microsoft. My name is Mainul Mondal, and I'm the founder and CEO of Ellipsis Health. I knew this is an AI conference, and while I could talk at length about machine learning and the technicalities of how we do what we do, I want to spend a few minutes talking about why we do what we do. At Ellipsis Health, we believe pushing the boundaries of machine learning so we can push the boundaries of care. We believe in using machine learning to better augment clinicians so that we can support our patients. We believe in providing machine learning solutions that promote human dignity and democratize healthcare so everyone can have access to a better health outcome. And how are we doing this? Through voice, we help people understand their emotional health. Using AI to quantify severity of depression and anxiety symptoms using only the human voice. And as we all know, better measurement has the ability to revolutionize healthcare. But before I talk about this revolution, I want to quickly talk about the revolution that happened over 100 years ago. Now, we all know this is clearly a blood pressure cuff. Invented in 1881, it revolutionized capturing a critical vital sign. By the 50s, they became standard of care. From the 50s to today, we saw a 72% decline in deaths due to heart disease, and many factors contributed to that. But fundamentally, being able to measure blood pressure changed the paradigm for healthcare. Now, this trend has been fantastic. Let's talk about something that has not. During the same time, we saw a 3 times increase in deaths due to despair, suicide, alcohol, and drug abuse. And that was prior to COVID. We're now in the world where depression and anxiety are the second most common pre-existing condition in the US. And think about what's happening globally. To face this challenge, we need to fundamentally change the paradigm in how we think about health and mental health. At Ellipsis, we ask, what if we had a blood pressure cuff for depression and anxiety? And I'm here to tell you that we do. We have pioneered the first voice-based vital sign for depression and anxiety symptoms using speech. Speech is where biology and psychology intersect. When we have a conversation, we share words, we share how we speak. NLP being the words, acoustic being how we speak. And that's how we connect. That's how we historically connect with other human beings. Today, Ellipsis Health is live with vital signs for depression and anxiety, using only 2 minutes of voice, answering open-ended questions, open-ended dialogue, low stigma topics. We're able to, in real time, detect depression and anxiety symptoms in patients. We have already deployed with multiple providers and national payers. Now think about this, voice is everywhere. Right? Behind our solution is some of the most advanced deep learning in the industry. We plug into existing touch points such as telehealth or digital front doors. From there, we take in the patient's speech and analyze it using our semantic and acoustic models. By the way, that has been trained on the world's largest data set for mental health and speech. Our algorithms create, in real time, scalable, consistent, vital signs for depression and anxieties for the care team. Our science is best in the world. We have validated in over 15,000 individuals from ages 18 to 80 years of age with representative ethnicities and genders. And if you think about the partners we have, the clinical partners who are making this happen with us, some of the names you've heard, Mayo, Hartford, Penn State, Vanderbilt, Desert Oasis, Mind Springs Health. All of these folks have helped us be who we are in serving humankind better. Now, all of this sounds great, But Ellipsis, we ask, what does it mean for Mary? What does it really mean for her and her family members? She's 43, mother of 2, has diabetes, also has depression and anxiety. But I would like you to invite you to think about not just Mary, but about people in your ecosystem, your parents, your partner, your spouse, friends, co-workers, your children. Think about their experience with these terrible diseases. The status quo isn't acceptable for them, and it's not acceptable for someone like Mary. Now, this is fascinating when I heard this, and completely unacceptable. On average, Mary will have to wait for 11 years from the onset of symptoms until she's identified by her primary care provider. In that time, her disease has not impacts her, it impacts her children, her family, her coworkers, and her community. Once she's identified, the journey she will have, at the very best, fragmented and reactive. She'll have to have long wait lists. She'll bounce around until she finds a provider that's a good fit for her. She'll have to try multiple medications and unfortunately, may even have a crisis event. This is unacceptable. Her care cannot be fragmented. Her care cannot be reactive. Mary and her family deserve so much better. At Ellipsis, we imagine a better world, a world where Mary's care is proactive and data-driven. And through scalable intelligence, she has a better care journey. And that care journey may look like something like this. Instead of waiting 11 years, she's identified tomorrow. For example, she has a telehealth call with her care team about her diabetes. She has right now no medical history, no family history, nothing that would indicate she's going through mental health issues such as depression and anxiety. Now, with a 2-minute assessment that Ellipsis provides, while she's in the waiting room, we can identify her and immediately notify her provider and our care team so she's taken care of. And we don't stop there. We fill the gap in care. The same way she checks her blood sugar, we would check in with Mary every week so that her team can get actionable longitudinal data. And with this data, Mary can better be triaged while she's waiting for care. And additionally, it can help our providers titrate medication. And think about this part. What if we can actually prevent an adverse event? Imagine the impact we can have as a community for someone like Mary. Now, with Ellipsis technology, we can create all this value for Mary. While there's no magic wand, there's definitely better chronic management using data. It's the same thing we do every day, monitoring with other conditions, other chronic conditions. Now, because of AI, we have a vital sign for depression and anxiety. And look, we're just getting started here, right? We are been smart working with partners who helps us design a lot of these things. We are API driven, web app driven. We are obviously standalone apps. We have tremendous partnerships with Google Cloud, Salesforce, Microsoft, AWS to be multi-cloud. And we have an extremely strong group of advisors at board members who are very, very much focused on privacy and security. We're HIPAA compliant, GDPR compliant, and we'll always put that as top of our fundamentals as we grow Ellipsis. Our roadmap right now, it's one voice and 2 vital signs, depression and anxiety. We're expanding into multiple languages. We're expanding into additional diseases such as bipolar, PTSD, cognition, fatigue, schizophrenia, and we'll be providing micro interventions. We will be there for every single individual to have the ability to measure and manage their own mental health and wellness and their families. That's where Ellipsis Health is heading. And look, we're just getting started. We want you to be our partner in this journey. Let's democratize mental health one voice at a time and join our global movement to reduce cost and stigma of mental health. And again, thank you so much to everyone for giving us this opportunity to share our thoughts and being on this journey with us.
Wow, thank you so much. Thank you for sharing this with us. This has been an awesome presentation, and I know the virtual crowd is going wild. All right, for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and check out our amazing AI exhibits. Thanks so much, and we'll see you around.